During their meeting in Cairo, the Palestinian factions have agreed to fully implement the Gaza ceasefire and lift the blockade entirely, pledging to transfer administration to an independent technocratic committee and to coordinate next steps with mediators. With Egyptian, Qatari and Turkish mediation, the factions endorsed the second phase of President Trump's plan, committing to full ceasefire compliance and the complete lifting of the Gaza blockade. The final communiqué backs reconstruction and the withdrawal of Israeli forces and an international monitoring and funding mechanism to oversee delivery and projects. The group pledged national unity under the Palestine Liberation Organization and condemned Israeli annexation moves in the West Bank. They further expressed appreciation for Egypt's pivotal role and President Abdel Fattah al-Sisi's support, saying coordination with partners will continue to translate commitment into timelines and implementation. The Fatah movement has affirmed that the statements issued by several Palestinian factions yesterday underscore that the true guarantor of any unified Palestinian vision is the Palestine Liberation Organization and the State of Palestine. The movement stressed that unilateral policies or attempts to bypass national legitimacy will not succeed. Fatah emphasized the need to establish a professional administrative committee composed of qualified experts to manage Gaza's affairs temporarily under the authority of the Palestinian government. It reiterated that security in Gaza is the responsibility of official Palestinian security forces and any international presence should remain at the borders. The movement also called for a unified authority, weapon and law under a national framework. Egypt has established an integrated network of logistics centers to receive, store and package humanitarian aid bound for Gaza, with 7 major hubs preparing and dispatching convoys under a plan to keep assistance flowing safely and continuously. Cairo says the new logistics network is designed to streamline the rather full aid cycle from intake and warehousing to packaging and lead out before convoys move to Gaza. 7 primary hubs are now dedicated to preparing and directing shipments under a centralized plan that prioritizes safely, steady throughout and predictable scheduling. Others, officials say the system standardizes receipt and packing process to reduce delays, maintain cold chain and critical care supplies, and support sustained convoy operations. The approach is intended to stabilize flows over time and ensure aid reaches medical facilities and communities as needs persist. That comes as 2,062 aid trucks have entered the Gaza Strip from October 18th till October 23rd. The World Health Organization moved 238 pallets of medical supplies into Gaza through Kerem Abu Salem, delivering insulin, cholera kits, assistive devices and other essential medicines as part of an expanded emergency push. The WHO says the convoy through Kerem Shalom carried infection prevention control equipment, medical consumables and assistive devices alongside critical drugs like insulin. Health Emergency Chief Dario Bertetto said the shipment is aimed at sustaining outstretched facilities amid persistent shortages. The agency adds it has more than 2,000 additional pallets staged for dispatch via Jordan, Egypt, Dubai, the West Bank and Jerusalem, pending clearances and secure access. The aid delivery is part of a wider effort to stabilize primary care and hospital services, manage outbreaks and support chronic patients who have struggled to access treatment. The WHO says further movements are ready once corridors and logistics align.